So who are the patients with this type of lung cancer? Now, patients tend to be younger, but really can be seen at any age. In clinical trials of EGFR exon-20 lung cancers, average age was around 60s, but there were patients in their early 20s to upper 80s, so can be seen at any age. Patients usually have limited or no smoking history. Again, in clinical trials, about 50 to 70% of patients do not have a smoking history, but patients with smoking history can still have this type, so it's still important to test. And we see this lung cancer type mainly in adenocarcinomas. So how do we find this particular type of lung cancer? So the most common way to do the testing would be using a biopsy. And as doctors, we may refer to these tests as molecular or genetic tests. You may have also heard the term NGS, which is short for next generation sequencing. And these are all referring to the molecular tests that are done on the biopsy material. These may be commercial tests or tests developed by individual cancer centers. Now, very commonly, blood is also used for molecular testing. But if the initial blood test does not show a genetic abnormality, then you may still need a biopsy for the test because blood tests can miss genetic mutations in the tumor. The third thing I would say is that older methods of genetic testing for EGFR do not always include this particular mutation. So if it has been a while since your tumor was tested and you were told your tumor does not have a genetic mutation, it may be worthwhile retesting. Now, I know many of you have looked at your own test reports, and the reports can be very confusing, not just for patients, but it can be very confusing for doctors as well. Some reports may spell out EGFR exon-20 insertion, which would make things easier, but there are many reports that don't have this term and may look like the letter soup I'm showing you here. And these are also exon-20 insertion mutations. So make sure you're asking your oncologist for explanation of results.